So my next guest, Jyoti Shelar. Data gaps aren't just statistical errors, they are missed opportunities to save lives. And nowhere is that clearer than India, as you heard earlier today from Dr. Baduk, a nation facing a rising cancer burden with surveillance systems that leaves millions invisible. Jyoti laid bare this crisis in a powerful article in which we will also share the link to, Bridging the Cancer Divide, India's Missed Opportunity. I sat down with Jyoti to discuss this real world consequence when a country sees only a fraction of its people. Welcome, everyone. We are incredibly privileged to be joined today by Ms. Jyoti Shelar, an independent journalist and strategic communication advisor with nearly 2 decades of dedicated work experience in public health and storytelling. For 17 years, Jyoti has been a vital voice on the front lines of health journalism in India, reporting for leading media houses on the critical intersections of health, gender, and community. Her deep on-the-ground experiences with was further honed in a global context, most recently serving as the communications lead for the World Health Organization in Timor-Leste. Her work, including her pivotal article that has brought her to this conference, is Bridging the Cancer Data Divide, India's Missed Opportunity, makes her voice essential for our Congress. Count us in data dignity, disruption in global cancer equity. Jyoti's reporting doesn't just highlight the problem, it gets to the very heart of our mission. She understands without robust and equitable data, we cannot help restore dignity to every patient. And by identifying India's missed opportunity, she is directly calling for the kind of disruption we need in how we collect, analyze, and act in cancer intelligence. She powerfully demonstrates that the data divide is not just a statistic gap, it is a gap in care, a gap in policy, and in justice. Her insights are crucial as we gather to build a more equitable future in cancer care. Please join me in giving a warm welcome to Ms. Jyoti Shelar. Jyoti.
Thank you for having me. It's a great honor to be on this platform. And I'm really looking forward for our conversation today.
Thank you so much. And so, without further ado, we will get started. And so, I was so moved by your article, and I mean, just things that in my wildest imagination, after our conversation, could not have envisioned happening. And so, let's just start off with, your article lays out the devastating systemic failures, right? But every investigation starts with a spark. What prompted you to write about this issue, and why does it feel urgent now?
I wouldn't say that there was one particular conversation or a striking thought that kind of acted as a spark for me. But I do believe that the spark to write this piece was a culmination of my years in health reporting, during which I've covered cancer extensively. I've written about various cancer trends emerging from Mumbai, the city where I've done most of my reporting from, and also pan India cancer trends. So when I looked back at my work and many other cancer narratives that were out there, I felt that there's a lot of focus on treatment and access to treatment. Cancer infrastructure, again, is another topic that gets a lot of focus. But the data, which is at the core of making these interventions, is kind of missing from the narrative. And by that, I mean cancer data is looked at in terms of cases, deaths, and trends and types of cancers. But there is little about the data infrastructure itself and the challenges that are faced to kind of upgrade that infrastructure. So while these thoughts were lingering in my mind, During my last work assignment in East Timor, I saw firsthand why cancer data infrastructure is so crucial. I saw there how young doctors were being trained to build cancer registry that is still in a very nascent stage, and as a result, cancer intervention was being planned on data that is very patchy, has high degree of uncertainty. But until registry becomes robust, the government cannot do much and has to do what data is in hand. So that experience kind of made me want to explore cancer data and the role of population registries a bit more deeply. And piece kind of that's how I think the idea in a way culminated.
Yeah, love it. So walk us through your investigation.
I started the research on this piece in a very journalistic approach. I would say I had a journalistic approach. Luckily for me, I had spoken to a lot of cancer experts in Mumbai about the basics of cancer registries. What is a population based registry and how is it different from a hospital based registry or a special cancer registry for that matter? Why is it expensive to set up these registries and the infrastructure around it? And a lot of challenges that kind of go on in getting manpower, office space, IT infrastructure, and to have that larger institutional and larger political will. So I had those notes with me, and that kind of became an entry point for me to start research in for this article. Then I began to kind of comb what's available on the public domain. I started with the National Cancer Registry Program, which is under the Indian Council of Medical Research, which is the main body that keeps all the registry data. And then there were nuggets of information from various white papers, studies, media stories, and other commentaries that were already there in the public domain on this topic. That kind of helped me stitch this piece together. But I think it's important to say here that as a journalist, when we write a story, the focus is often on what is happening and why it matters now. But in a research piece like this, the emphasis kind of shifts to why and how policy should respond. So that shift in perspective was very crucial, I think. And I'm really glad that I had the editorial guidance of people at the Observer Research Foundation, uh, the think tank that I wrote this piece for, which has helped me shape this into a more policy oriented, nuanced piece.
Yeah. Um, that and I love the fact that you said it shifted to the why, right? Because one of the things I think, especially in research, is that the whole point of it is to get to the why. And so that really, is amazing, to hear that that's, how you centered that, because otherwise we can't answer the question as to what's going on if we don't get to the why. And so with that, what was the most significant barrier, if you have, did you face trying to get a clear picture about this?
Again, I think the 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 biggest challenge I would say was fragmented nature of information, fragmented nature of data itself. For instance, if you look at the official figures of the coverage of the population-based registry on the National Cancer Registry Program's website, it ranges from anywhere between 10% to 19%. So there's no uniformity. On the same website, you'll find one figure, and if you go deeper into the website and pull out some other document, you'll find another figure. So there was no uniformity of data, which was a bit challenging because India is a densely populated country. So 1% and 2% means a large number of population. So that was one challenge. Secondly, I think there was a lack of clarity on how data is exactly collected, stored, and processed in different registries and different states. Um, for instance, population registries pretty much rely on active collection of data by the registry staff. Uh, but there are also a lot of attempts that are being made to digitize these processes. So it was hard to kind of get clarity on how these registries are transitioning between formats, like if they are paper based, digital, or hybrid. Are they using any standardized tools, or is there a particular format that they follow? So it was very hard to kind of comment authoritatively to describe the methodology, which is, I believe, crucial to gauge, the quality of the registry data. So that was definitely a second challenge that I faced while researching.
I could see that, being a challenge. I mean, and you brought up some amazing things. And you wrote in your article that this is a missed opportunity. Can you explain what opportunities were missed and why you think that happened?
So, Candice, if you really one of the easiest thing that comes to my mind is if you just look at the data uh, of the National Cancer Registry program, you will see that the program was set up way back in 1981, before many of the low and middle income countries perhaps even systematically started collecting cancer data. So this early start was, I believe, was a kind of opportunity for India to become a leader in cancer surveillance and having those data driven policies. But we are like talking now 4 decades later, and only a small share of population is covered, and several states still have negligible or no coverage at all. So that to me is a very, very real and clear missed opportunity, I think.
Um, I read something about um, that notification about cancer is not part of the communication structure. How is that possible? When I read that in your article, I was like, what? Can you relate a little bit about that?
So what happens is, let's say, for example, um, there's a government mandate to notify a particular disease. So all the public hospitals, all the private hospitals, even doctors with individual clinics, they are kind of like legally mandated to notify the disease if they get a positive case, or if they get a certain case, they'll notify it to the government. But when it comes to cancer, the disease is not notifiable. So a large number of patients could be getting treated in some particular hospital, or they are getting treated under a particular doctor, an oncosurgeon, but those cases are not being reported. So that data is not being captured. And India's health system, we have like a lot of public hospitals, but a large number of patients also go to private healthcare. So when there's no legal mandate, this private healthcare is kind of left out, and that's where the data is largely missing from as well. So that is one of the challenges. Yeah, that is the notification bit. But among all the Indian states, some states have taken the lead, and they have made a state-wise mandate to kind of report data, and that is happening to a certain level, but not as much as needed. So perhaps a national mandate is needed if we really need like data that's complete and comprehensive.
Wow. I mean, that's just that just floored me when I read that. I was like, not notifiable. Wow. So like that kind of floored me, right? So was there anything as you were writing, and going do your research for this article, was there any smoking gun or anything that you felt perfectly encapsulated the missed opportunity for India?
I think that's what, you rightly mentioned when the data is not notifiable. So I think the smoking gun was the coverage of rural population itself. If you look at the data, only about 1% of rural population is covered by the population based registry, which is deeply concerning for a country like India, where 65% of Indians live in rural areas. So that means a vast majority of people are essentially invisible in the national cancer data without kind of knowing where the burden lies and which communities are affected. How do you even design interventions that are truly effective and equitable then?
Oh my goodness, that's such a great question. Absolutely. How can systems be equitable if they're not being counted, right? And that was, and you said the very thing of why, why we felt that this title was so important. It was like, you cannot count. You cannot, if you're not capturing, you can't count, right? And if you can't count them, you can't get funding, right? And so how do we improve systems if we're not counting so that we can get funding?
Exactly. Absolutely. That's the point. Yes.
Goodness. Do you see this as an issue of equity and invisibility?
Yes, yes, absolutely. Again, going back to what we discussed just now, I do see it that way. So, disease trends are shifting, not just for cancer, but all the other diseases as well. Um, this is happening because of various factors like urbanization, changing dietary patterns, and, ultra processed food that was earlier not available in certain regions. Now it is getting more and more accessible. There is rising pollution. So all these factors are affecting populations very differently. And we only can understand how these are affecting the communities only when we have data coming out from, those small communities and those small regions. So when rural populations or marginalized groups or even poorer states in India are excluded from these registries, they are automatically excluded from policy planning and intervention strategies. So they are kind of an invisible lot. And as you said, invisible lot will not get any kind of investment. So that kind of connects, this entire picture.
Wow. And that's the thing, right? It's like, we believe that, at Global, GCCA, that everyone has the right to, have treatment, right? Regardless of where you're from, no matter what your social economic status is. And so it's just heartbreaking, to see that. And this is not just a challenge in India. One of the reasons why this was so important is that because we heard last year that this was a challenge across the globe. And we're like, okay, we need to have more conversations about this so that we can discover like, what is happening. And so we know that we can't fix everything, but we would love to, but at least if we can shine a light, on this, like what can we do? And then, and then how are people obtaining treatment, right? I mean, because if they're not being counted, what else are they missing? Like how, is treatment a challenge there as well? Obtaining treatment?
Treatment is definitely a challenge. Again, you see these trends kind of replicate. You see a lot of cancer registries are, concentrated in urban India. So similarly, the treatment centers are largely concentrated in the urban centers, and that's the reason you see a lot of influx of population coming from the poorer states and far off places coming all the way to Mumbai and other urban centers to get treatment. So that treatment is definitely a problem, but it is improving because there is a focus, there is a trust on cancer treatment. We have one of the biggest and Asia's largest hospital in Mumbai, the Tata Memorial Hospital, which sees a very high footfall of cancer patients across India. And the Tata Memorial Center is now kind of actively involved in decentralizing cancer care so that, more centers like the Tata Center could be built in different parts of India so that people don't have to travel all the way to the city to get treatment. So that is happening. But at the same time, yes, treatment is continues to be a very big problem because the very burden of cancer is so high. You in 2025, uh, if I go by the data that I've quoted, almost 1.4 million cases. I'm sorry, it's almost 1.6 million cases it was supposed to be 1.4 million in 2023, and the estimates had said that by 2025 it's already going to touch 1.6 million. So that's a huge burden. So treatment is always going to be a problem. But when you have data which is kind of specifically telling you uh, what are the problems, what are the micro issues, what are the micro trends that are emerging, then you can really do that kind of micro planning. And I do believe that uh, having good data will eventually help in the treatment part as well.
Yeah. Wow. Um, what has the responses been to your publication? Have you engaged with any officials regarding your publication?
So I have received a lot of responses from doctors, mainly oncologists, because this is an issue that is very close to their hearts. It resonates with them. But I do hope that the piece kind of helps trigger conversation and even action at the government level, because I think that's where the attention and investment is needed from. So I do hope that happens.
So I got a question for you. So, like, after everything that you've seen, if you were tasked with like improving, and coming up with a new model, what would be like your top recommendation for like a new model for data collection in India that from your, just from what you've done, what would you think would be a great place to start for a new design for data collection, in your opinion, not anything else?
Yeah, I do believe that I may not be the right person to answer this, but I'm going to attempt it anyway. Uh, See, India has some of the best cancer specialists, and a lot of work is already happening in India in terms of building cancer registries. And very interestingly, Indian experts are hand-holding many smaller countries to build their registries as well. So there's a good network of experts that are kind of, the who are helping each other to build the registry. So the expertise is already there. What perhaps is needed is a more coordinated effort. But again, India is such a densely populated country, such a vast country. So it's a tricky kind of ambition in a way to have everybody use a standardized tool, to have everybody very genuinely record that data. So it is a task. Uh, I don't know if I can really comment on the design and what kind of tool it could be, but I do believe that there has to be some uniformity, and there has to be a mandate so that everybody understands the importance of data collection and everybody does it with some genuine interest. So there has to be that seriousness that has to come not at just the Tata level, wherein you have the bigger hospital, so there is seriousness to collect data. But when you go to a smaller clinic, an individual clinic, there is no there is no interest to collect data. It shouldn't be that bifurcated. I think that that passion, that interest, and that need should run down from ground to up.
Yeah. Well, I mean, you answered it amazingly for someone who didn't feel that that they were the right person. I think you did an amazing job. And I would ask this for, so for those that are watching us and tuning in and listening, and they're advocates, they're policymakers, they're NGOs. What do you hope your article will inspire? Um, After people reading, because we are definitely going to share this article, but for those of us who are advocates in this space and are looking to make a difference, what do you hope to inspire from your article?
I do hope that it inspires them to see data as a public good and not just a numerical, technical exercise that just needs to be carried out. Because I think cancer data, especially from the underreported and underrepresented regions, is very crucial for national cancer control planning. And I do hope that it flicks a switch somewhere, reminding the decision makers that without inclusive, comprehensive, reliable data, even the best intentioned policies can leave out people for whom they are needed the most. So, yeah,
Yeah.
I hope that happens.
It's amazing. But Joy Tay, thank you so much. And thank you for making the critical link between data and human dignity the perfect, you know, perfect segue for for our conference, right? Because so often this is something that we are not realizing, is the challenge, that and how important data collection is, and and just making that connection, because every one of us wants to be counted, and and that dignity of being seen and being heard. And so thank you so much for tying that together with a powerful reminder that we cannot fix what we cannot count. Thank you so much, and we appreciate you for being on with us today.
Thank you. Thank you for having me. And it was a wonderful conversation. I'm glad that I could participate.
Thank you. And thank you so much, everyone, for tuning in. And can't wait for our other sessions for you to tune in for later on today. Thank you so much. Did you get that? You cannot capture what you cannot count. So make sure you take notes of that, because that is definitely the beginning phrase for a movement. And I want to thank Joy Tay so much for sharing her perspective. And we will definitely send the link to the article. And so now we're about to do a poll. Yes, we are, because we want to know, is cancer a reportable disease in your country? I don't know about you, but that floored me. Not being cancer, not being a reportable disease. My God. So let's see what it looks like in your country or where you are. All righty, let's see here. Wow. Well, this is good to see that 73% said that cancer is a reportable disease.